Now at 6, hospitals and sheriff's departments across North Carolina are at odds over a new law regarding mental health evaluations for accused criminals.
The debate involves the new Irena's Law, which mandates mental health evaluations when necessary. The disagreement is over where those evaluations should take place. WECT's Ariana Bertolotti heard both sides of the argument today. Again, Ariana, this comes down to where both sides believe those evaluations should happen.
Yeah, that's right, John. Even though the law points to the hospitals undertaking the evaluations, not everyone agrees that that is the best option.
When the state lawmakers passed Irena's Law in 2025, it was meant to help violent offenders with mental illness and prevent them from endangering others if they were to be released without receiving care. The law allows for a judge to order a psychiatric evaluation if someone is charged with a violent crime and shows their mental health state could be a danger to themselves or others, or if they have been previously involuntarily committed to a psychiatric hospital within the past 3 years. However, the state has had some issues implementing the law.
We're trying to figure out the best way to do assessments and treatment for patients who suffer mental illness who also have been involved in an allegation of a serious crime.
The law states the judge-ordered psychiatric evaluation should take place at a hospital emergency department or a crisis facility. And that's where things get tricky. The North Carolina Healthcare Association is pushing for those evaluations to take place within the jails and detention centers via telehealth. They cite patient and staff safety as a primary concern. However, county detention centers are ran by local sheriffs, and the State Sheriff's Association says those evaluations should happen within a healthcare facility, not a jailhouse.
Taking someone with mental health needs and putting them in a jail is probably going to make their mental health problems even worse.
Within the last few weeks, New Hanover County saw a case where someone was charged with a violent crime and the judge ordered a psychiatric evaluation. So the judges are utilizing this new law. That's why Representative Reeder is part of a committee in Raleigh, seeking a solution to the standoff between hospitals and law enforcement.
This is a complicated problem that has multiple stakeholders, and what I'm looking for, what the committee's looking for, is for different people to come together to say, this is how I can help address this problem or this part of the problem.
So the state can get back to the original intent of Irena's Law, caring for people who need help and protecting the public.
The committee in Raleigh says this is not a problem they'll solve overnight. They are likely looking at months worth of meetings. Ariana Bertolotti, WECT News.